Welcome to our discussion on advanced trauma management.
Absolutely.
We're diving into a resource that tackles 100 questions and answers in advanced trauma life support. And it's packed with practical insights to bridge theory with real-life emergency care.
Right. It's impressive how it distills everything from airway management to damage control surgery. And it gives us a structured way to think about the ABCDEs, like starting with airway assessment while protecting the cervical spine.
Absolutely. It's like the primary survey really lays the foundation with the A for airway and cervical spine precautions, a critical step in trauma because every second counts. And then it systematically moves on to cover breathing, circulation, and all that.
And the fluid therapy part is interesting, isn't it? It emphasizes starting with crystalloid solutions like normal saline or lactated ringers, reminding us to escalate care only if those initial steps fail.
Right, and then there's the whole management of tension pneumothorax, needle decompression followed by chest tube placement, which is basically life-saving in the field. It's clearly laid out. Making it a quick reference during those critical minutes, definitely key.
I also appreciated the section on secondary survey, ensuring no injury is missed once the immediate threats have been managed. It's like doing a head-to-toe check after stabilizing the patient. Exactly. And the importance of the log roll technique to check for back injuries is reinforced. That detail is gold in terms of thoroughness.
Yeah, it provides detailed explanations and rationales behind each answer. It's not just about memorizing responses. It's about understanding why each step is vital.
Yeah, that really helps build a deeper clinical intuition. Although I have to respectfully challenge one aspect. Don't you think the book occasionally underplays the challenges of rapidly responding in chaotic scenarios? It seems the structured approach is meant to serve as a framework rather than a detailed emergency manual. Exactly. And it encourages practitioners to adapt these guidelines to the unpredictable nature of trauma. Yeah, that's fair.
And let's not forget the inclusion of advanced topics like damage control surgery and even discussions on the lethal triad, hypothermia, acidosis, and coagulopathy, which really underscores the complexity of trauma care, yet so crucial for refining our decision-making in high-stakes scenarios.
It's also cool how the book is backed up by strong references from leading trauma manuals and courses, showing that these principles are both up-to-date and thoroughly vetted by clinical practice. Yeah, it really adds to its credibility.
Right, and the author's own journey in trauma care shines through in the preface, inspiring readers to continuously learn and adapt in this ever-evolving field. And it makes you feel like every question is
inspiring indeed.
Backed by a real-world experience, truly pragmatic.
So, in sum, this resource isn't just a dry Q&A manual. It's a comprehensive guide that takes you through the practical, the theoretical, and even the challenging nuances of trauma management. And for anyone in emergency care, it's like a trusted companion. Definitely.